Borderline personality disorder, BPD, in children and adolescents, treatment approaches for adolescents with BPD. Borderline personality disorder, BPD, is a complex mental health condition that often first presents in adolescence or early adulthood. Although diagnosing BPD in children and adolescents can be challenging, early intervention is crucial in helping young people manage their symptoms and prevent long-term emotional distress. Adolescents with BPD often experience intense emotional instability, impulsivity, difficulty in relationships, and identity confusion, which can significantly affect their development, relationships, and mental health. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore the most effective treatment approaches for adolescents with BPD. By understanding the available therapeutic options, we can support young people in developing the skills they need to manage their emotions, build healthy relationships, and promote positive development. 1. Importance of early intervention and treatment for adolescents with BPD. Early diagnosis and treatment are crucial for adolescents with BPD because the emotional and relational challenges they face can deeply impact their personal growth and mental health. Left untreated, BPD symptoms can worsen over time, leading to chronic emotional difficulties, relationship problems, and the development of comorbid mental health conditions such as anxiety, depression, and substance abuse. Key fact: treatment in adolescence is particularly important because it can prevent the escalation of symptoms into adulthood, where untreated BPD can lead to chronic emotional instability and difficulty with relationships. Early intervention can help adolescents develop healthier coping mechanisms, improve their emotional regulation, and build a more stable sense of self. 2. Treatment approaches for adolescents with BPD. Several evidence-based therapies have been shown to be effective in treating borderline personality disorder in adolescents. These treatment approaches focus on emotional regulation, impulsivity control, interpersonal effectiveness, and building a stable sense of identity. 2.1 Dialectical Behavior Therapy, DBT, for adolescents. Dialectical behavior therapy, DBT, developed by Dr. Marsha Linehan, is one of the most effective therapies for treating BPD in adolescents. DBT focuses on helping individuals regulate their emotions, tolerate distress, improve interpersonal skills, and increase mindfulness. Key components of DBT. Emotion regulation, teaching adolescents how to identify, label, and manage their intense emotions without resorting to destructive behaviors such as self-harm or impulsivity. Mindfulness, helping adolescents become more aware of their thoughts and feelings in the present moment, which can reduce emotional overwhelm and improve self-control. Distress tolerance, teaching skills to manage emotional crises without resorting to harmful behaviors. Adolescents learn how to accept discomfort rather than acting out impulsively. Interpersonal effectiveness, teaching communication skills and how to manage relationships in a way that promotes stability and mutual respect. Benefits of DBT for adolescents. DBT helps adolescents with BPD understand and manage their emotions in a healthy and constructive way. Research shows that adolescents who receive DBT show significant improvements in emotional regulation, self-harm behaviors, and interpersonal difficulties. 2.2 Mentalization-based treatment, MBT. Mentalization-based treatment, MBT, is another effective therapy for adolescents with BPD. It focuses on helping adolescents understand and make sense of their own emotions and the emotions of others. This therapy aims to improve empathy, self-reflection, and the ability to recognize and interpret emotional cues in social situations. Key components of MBT. Mentalizing, teaching adolescents to better understand their own emotional experiences and those of others. This helps them form healthier relationships and respond appropriately to emotional situations. Self-reflection, encouraging adolescents to reflect on their own thoughts, feelings, and behaviors, allowing them to recognize patterns of behavior and gain greater control over them. Benefits of MBT for adolescents. MBT helps adolescents develop a stronger sense of self and better understand their emotional responses in relationships. It is especially helpful for adolescents who struggle with identity confusion and interpersonal difficulties, two hallmark features of BPD. 2.3 Cognitive Behavioral Therapy, CBT. Cognitive Behavioral Therapy, CBT, is a well-established, evidence-based approach to treating various mental health conditions, including BPD. CBT focuses on changing negative thought patterns and behaviors and developing healthier ways of thinking and coping with difficult emotions. Key components of CBT for adolescents with BPD. Cognitive restructuring, helping adolescents recognize and challenge negative thought patterns that contribute to their emotional instability and interpersonal difficulties. Behavioral skills training, teaching adolescents how to change maladaptive behaviors, such as self-harm or substance abuse, by developing healthier coping mechanisms. Problem solving, encouraging adolescents to develop practical strategies for dealing with stressful situations, reducing impulsivity, and avoiding relationship conflicts. Benefits of CBT for adolescents with BPD. CBT helps adolescents identify and change unhelpful thought patterns, reducing emotional distress and impulsive behaviors. It also improves self-esteem and problem-solving skills, allowing adolescents to better manage their emotional challenges and relationships. 2.4 Family Therapy. Family therapy plays a significant role in the treatment of adolescents with BPD. Given the impact BPD has on relationships, involving family members in the treatment process helps improve communication, understanding, and support. Family therapy can also educate family members about BPD and teach them how to provide a stable and supportive environment for the adolescent. Key components of family therapy for BPD. Education, teaching family members about BPD, its symptoms, and the challenges adolescents face. This helps reduce misunderstandings and provides insight into how to offer support. Improved communication, helping family members communicate more effectively, especially when dealing with emotional crises or conflict. Setting healthy boundaries, teaching families how to set clear and consistent boundaries with the adolescent while still offering emotional support and validation. Benefits of family therapy for adolescents with BPD. Family therapy fosters a better understanding of the adolescent's emotional struggles and helps family members provide the appropriate support. It can help reduce conflict within the family and create a more nurturing and stable home environment. 2.5 Support groups and peer support. Adolescents with BPD may benefit from peer support groups, where they can connect with others who understand their struggles. These groups provide a safe space for adolescents to share their experiences, learn from others, and practice new social skills in a supportive environment. Benefits of peer support for adolescents with BPD. Peer support groups help adolescents realize they are not alone in their struggles and can provide emotional validation. Sharing experiences with others who understand BPD can foster a sense of belonging and community, which is especially important for adolescents who feel isolated or misunderstood. 3. The role of medication in treating adolescents with BPD. While medication is not typically the first line of treatment for BPD, it may be used in some cases to manage comorbid conditions, such as depression, anxiety, or mood swings. Medications such as antidepressants, antipsychotics, or mood stabilizers may be prescribed as part of an integrated treatment plan to help adolescents with BPD manage symptoms. Key fact: medication should be used in conjunction with therapy, such as DBT or CBT, for the most effective treatment. It is important that medication be prescribed and monitored by a qualified mental health professional to ensure it is addressing the right symptoms. 4. Conclusion. Effective treatment for adolescents with borderline personality disorder, BPD, involves a multifaceted approach, combining therapy, family support, and sometimes medication to address the emotional, relational, and behavioral challenges associated with BPD. Early diagnosis and intervention are crucial for helping adolescents develop emotional regulation skills, build a stable sense of self, and establish healthy relationships. Dialectical behavior therapy, DBT, mentalization-based treatment, MBT, cognitive behavioral therapy, CBT, and family therapy are all important treatment options that can significantly improve the quality of life for adolescents with BPD. By providing the necessary support and therapeutic tools, We can help young people navigate the challenges of BPD and develop the skills they need to lead fulfilling and stable lives. In future episodes, we will continue to explore treatment options, support strategies, and the importance of early intervention in helping adolescents with borderline personality disorder, BPD. Stay tuned for more insights into BPD and how to support young people on their journey to healing and growth.